Hello everyone and welcome back to the channel. Today, we're going to talk about a medication called Hydralazine. If your doctor has prescribed this for you, it's most likely to treat high blood pressure, also known as hypertension. Now, why is high blood pressure such a big deal? Think of it this way. It forces your heart and arteries to work overtime, 24/7. Over time, that constant strain can lead to serious damage, increasing your risk for things like a stroke, heart failure, or even kidney problems. This is where hydralazine steps in. It's what's known as a vasodilator. That's a fancy word, but its job is simple. It helps your blood vessels relax and widen. Imagine a crowded highway suddenly getting a few extra lanes. Traffic flows smoothly, right? That's what hydralazine does for your blood. It makes it easier for blood to flow, which lowers your blood pressure, reduces the strain on your heart, and helps get more blood and oxygen to your vital organs. It's a key player in protecting your long-term health. You might also see it used in emergency situations for a hypertensive crisis or to manage high blood pressure during pregnancy. Of course, hydralazine is a prescription-only medication, so this conversation always starts with your doctor. Before you start any new medicine, safety is the #1 priority. You need to have a detailed chat with your doctor, but here are some key things to bring up. First, allergies. If you've ever had an unusual reaction to hydralazine or any other medications in the past, make sure your doctor and pharmacist know. Second, your medical history. Hydralazine isn't for everyone. If you have existing heart conditions like coronary artery disease, a history of heart attack, stroke, kidney disease, or a condition called lupus, your doctor absolutely needs to be aware of it. Third, drug interactions. It's so important to tell your healthcare team about everything you take. This includes other prescriptions, over-the-counter meds for colds or asthma, and even supplements. Some combinations can affect your blood pressure or cause unwanted side effects. And for those who are pregnant or breastfeeding, while studies suggest minimal risk to the infant, your doctor will always carefully weigh the benefits against any potential risks for your specific situation. Now let's talk about the most important part: taking the medicine correctly. Always, and I mean always, take hydralazine exactly as your doctor directs. Don't ever change your dose or stop taking it without talking to them first. It's common for your doctor to adjust the dose a few times at the beginning to find the perfect amount for your body. For the best results, it's usually recommended to take it on an empty stomach. That's about 1 hour before a meal or 2 hours after. If you're using the liquid form, you can mix it with a little fruit juice or applesauce, but make sure you take the entire dose right away after mixing. Here's a really critical point. Hydralazine controls high blood pressure. It doesn't cure it. This means you'll likely need to keep taking it every day, possibly for the rest of your life, to stay healthy. Even if you feel perfectly fine, and many people with high blood pressure don't feel any symptoms, it is vital to stick with your medication and keep your follow-up appointments. What if you miss a dose? It happens. Just take it as soon as you remember. But if it's already close to the time for your next dose, just skip the missed one and get back on your regular schedule. Never ever double your dose to try and catch up. Finally, let's cover side effects. Like any medication, hydralazine can have some. As your body adjusts, you might experience some common and usually temporary side effects, like a headache, some dizziness, or diarrhea. If these don't go away, or they really bother you, let your doctor know. However, there are some more serious symptoms that mean you should call your doctor right away. These include chest pain or tightness, a fast, pounding, or irregular heartbeat, shortness of breath, or any unusual joint pain, fever, or easy bruising. Also, because this medicine relaxes your blood vessels. You might feel a bit dizzy or lightheaded if you stand up too quickly. A simple tip is to just get up slowly from a sitting or lying position, and until you know how hydralazine affects you, be cautious when driving or doing anything that requires you to be alert. Your doctor will monitor you with regular checkups to make sure the medicine is working safely and effectively. Hydralazine is a powerful tool to help you manage your blood pressure and protect your heart for years to come. By working closely with your healthcare team and taking it as prescribed, you're taking a huge step for your health. Thanks for watching today. If you found this video helpful, please give it a thumbs up and consider subscribing for more health content. See you in the next one.